Hey, welcome to another installment of OrthoCarolina's live webinar center. My name is Dr. Robert Morgan. I'm an orthopedic sports medicine surgeon at OrthoCarolina. I've practiced at the Concord office for the last 13 years. My practice focuses on shoulder conditions in patients from teenagers all the way through older adults and knee and elbow problems from teenagers to the weekend warriors. Our topic this evening is on rotator cuffs and its condition. For questions, please drop them in the comments and we will be happy to answer them at the end. So the first question we always get when it comes to rotator cuff is, what is the rotator cuff? And it's a group of four small muscles deep to your deltoid muscle. There's one in the front, one on top, and two rotator cuffs in the back. And the job of the rotator cuff muscles is to keep the ball on top of your arm centered in the socket, so when your large arm muscles like your deltoid and pectoralis major muscle move, the shoulder has a stable base for the shoulder to rotate through. The question then comes, well, what are the symptoms when there's damage or trauma or a tear to the rotator cuff? And number one is pain. The general location is pain in the front of the shoulder or the side, and it radiates down towards the mid-arm. Patients come in a lot of times thinking they almost broke their arm, but they didn't have an injury. And usually that's an indication that they have a rotator cuff tear. The second trick is, in terms of the pain, is people complain of pain mainly at night sleeping. So it hurts more at night when you're trying to rest than it does during the day. And then they notice weakness as a third complaint. And they'll come in and say they feel strong close to their body, but if they're trying to lift away from their body or up overhead, that's when they start having loss of strength and pain in that location. So sleeping with shoulder problems, specifically the rotator cuff and in general, tricks to help sleeping at night is actually sleeping sitting up like you're in a beach chair position. So it'd be more comfortable sleeping with extra pillows or a wedge pillow, or on a really bad night, the recliner, than trying to lay flat type deal. People will heat during the day, but try ice at night before bedtime to help alleviate some of the discomfort. And in addition of taking regular over-the-counter anti-inflammatories, taking an over-the-counter sleep aid like Tylenol PM or over-the-counter Unisom can help you get to sleep quicker and deeper, or maybe you can rest better. So when it comes to rotator cuff, there's usually two types. The first one is an acute type tear, and we think of that in patients younger than age 60. They've never really had a history of shoulder problems or injuries before, and they have a very distinct injury. Usually it's a fall or something fell and they reached out. They feel pain and a pop, and they have immediate pain type deal. However, the more common rotator cuff tears, what we call degenerative tears. Those are usually in our patients older than the age of 60. They don't necessarily have an injury. They'll come and say, hey, my shoulder just started hurting for the last 6 months. I thought it would get better, and it didn't. And they usually will have episodes where they'll tell us, hey, last year my shoulder hurt for no reason for a couple of weeks and it got better. Or they'll say, hey, I had a cortisone shot for bursitis a couple of years ago and it got better. When a degenerative tear, just like putting miles on a tire, our shoulder each year, we're putting miles on our rotator cuff. And the rotator cuff's like a thick rope. And with time and age and use, the rotator cuff will fray and some of the strands will unravel, and that will cause some periodic tear. If it doesn't get better, it just means the damage is starting to get a little bit larger, and it's hard for your shoulder to kind of reestablish that balance. So people always ask, well, how do you know it's a rotator cuff tear? The biggest thing is just listening to the patient. How old is the patient? What was their injury pattern? Where is the pain? How is it hurting? Usually tears. Well, to confirm it in the office, the hallmark exam is doing what we call a drop arm test, and we'll raise the patient's arm in front. The surgeon will place the hands on top of the patient, and the surgeon will say, I'm going to push down. I want you to raise up. And in a normal shoulder, I shouldn't be able to push the arm down. Well, in a shoulder with a rotator cuff tear, me pushing down and the patient pushing up, one will cause pain, but they'll also have weakness through that. There are several findings on X-ray. And sometimes people say, well, it's a muscle problem. Why are you getting an X-ray? We can learn a lot from X-rays to kind of give us an idea of how long this process has been going on. The X-ray you see is an X-ray of a straight ahead view. So it's almost like you'd be looking at yourself in a mirror. You can see the top of the humerus or the arm bone, and then the sockets on the edge of the shoulder blade. At the yellow arrow, you'll start to see a little bit of bone spur. You'll see how sharp that white line is by the yellow arrow, how curved it is. There's a little bit of bony debris. And then on top of the arm bone, where there's a yellow circle, you'll see that looks a little, what we would call bumpy or cystic, where you see little black dots. And what that tells me is every time the patient has been raising their arm over eye level, the edge of the arm bone in the circle has been hitting the shoulder blade where the arrow is. And they've been making bone-to-bone contact enough where there's been able to make changes in the x-rays. And that usually takes almost a year of that process going on to make those x-ray changes. So if this patient comes in and said, hey, the pain started 2 months ago and we have this x-ray, this is an indication of saying, listen, the process has been going on for a lot longer than 2 months. Now, the pain and the symptoms happened 2 months ago, but the process has been going on for a while because it takes longer than 2 months to make some of the x-ray changes. The third thing we can see in the x-ray is the flat yellow line at the bottom of the ball should be lined up with the flat line with the bottom of the socket. So those lines should be straight across. And you can see the bottom of the ball is higher than the bottom of the socket. And what that means is we have a large rotator cuff tear. And now the rotator cuff has lost the ability to push the ball and keep it stable in the socket. So once we decide, or the patient decides it's in their best interest for surgery, what we normally do is get a confirmatory imaging, either an ultrasound or an MRI. There are a couple of reasons for this. One, insurance usually dictates that there's advanced imaging for insurance to approve the surgery. But I always tell patients, we're not going to get an ultrasound or MRI to tell us we have a rotator cuff tear, right? We know the rotator cuff, or that you have a rotator cuff based off the history and the physical exam. We're going to get an MRI and ultrasound to kind of tell us what the tear is like. How large is it? How far away is the rotator cuff pulled away from the arm bone? And then also from the advanced imaging, you can somewhat kind of fine tune what the recovery period is going to be. In my practice, we're fortunate enough to have Scott, one of our providers here at the Concord office, that's facile with the ultrasound probe. For rotator cuff problems of the shoulder, I prefer ultrasound over an MRI for a couple of reasons. One, it's cheaper to the patient, so it costs patients less. Number two, it's quicker because we don't have to wait for insurance approval for an MRI. And number three, it's more comfortable to the patient. So for an ultrasound, we just ask that you wear a t-shirt in the office, you're in the exam room. And just like you put an ultrasound probe on a pregnant lady's tummy, we just put the ultrasound probe on your shoulder. Instead of looking for a baby, we're looking at the rotator cuff, looking for the tear, looking at the bicep, looking at shoulder bursitis. And we can gather information to formulate our surgical plan from that information type deal. When it comes to rotator cuff tears, there's usually two main types of treatment. The first is non-surgical, and that works about 70% of the time. If a patient's main complaint is pain and trouble sleeping at night, a cortisone injection in the office can help bring relief to allow them to rest more comfortable. And then normally I'll send a patient to physical therapy once or twice to learn some very specific exercises for them to do at home. And the key is for the patient doing them at home. I'll usually ask that the patient do it 3 times a week for 8 weeks. And we usually have about a 70% chance, especially in degenerative rotator cuff tears, of this treatment plan improving the patient's symptoms where they're satisfied with it. The other treatment plan would be surgical intervention. Now, when it comes to rotator cuff surgery, this is an outpatient surgery procedure. So come, have the surgery, go home. It's usually performed, at least in my practice, in a low-cost surgery center type deal. You do go to sleep, and the anesthesiologist also gives you what we call a shoulder block. And this is where the anesthesiologist, before the surgery, injects numbing medicine to the nerves that go down to the arm to make the arm numb. And this helps with post-op pain control. Now, rotator cuff tears are fixed through small poke holes, so there's no long incision anymore. Through the poke holes, you put the camera in. And I tell people, once the camera's in the shoulder, it's just like us looking at each other. There's no guesswork type deal. So The picture you see on the screen is an arthroscopic picture of an actual surgical picture. The white is the edge of the rotator cuff. The yellow is the top of the arm bone. And that metal instrument to the right is in between the arm bone and the rotator cuff. And that space where that instrument is, you should not be able to see that space. That is the rotator cuff type deal. So from a technical standpoint, type deal, when it comes to the rotator cuff, all we're doing at surgery, as I'll tell people, is we're sewing the muscle down for your body to heal. And what we'll do is we'll pass stitches through the rotator cuff and then usually use little drywall anchors and bury that in the arm bone and use that to sew it down. So at surgery, our job is to sew the muscle down for your shoulder to heal type deal. And unfortunately, everybody heals the same from rotator cuff tears. So 60-year-olds heal about the same as 75-year-olds, the same as 45-year-olds. Everybody heals equally as slow type deal. I describe when I'm repairing a hole in the rotator cuff, it's like patching a hole in a tire. And if we don't like how the tread of the tire looks on the rest of the tire, we do have more innovation where now we'll start to use what we have, a little collagen protein patch that we can put on top of the rotator cuff that we have repaired. And we just use small purple staples that are absorbable and use that to sew the patch down to your rotator cuff. The addition of the patch has two purposes. One, it kind of acts as a lattice or a railroad track to help orientate your healing rotator cuff down to the bone, which in theory will allow us to have a better result of your rotator cuff healing. It also brings new tissue to the rotator cuff. It incorporates into your rotator cuff about the first 6 months of surgery, so it gives us a thicker rotator cuff or more tread on the tire, which lowers the chances of re-tearing down the road type deal. Now, the biggest question when it comes to rotator cuff is what is the recovery? And people go, what's the most painful part of the surgery? And it can be a little sore the first couple of days after surgery, but the biggest painful part of rotator cuff surgery is just it's painfully long. There's no way to speed up a rotator cuff recovery. You know, everybody wants rotator cuff recovery to be like NASCAR, bigger, stronger, faster. Let me work harder and get better quicker. And unfortunately, rotator cuff recovery is more like Johnny Cash, walk the line, Mother Nature healing, watching paint dry. So a typical rotator cuff recovery, again, outpatient surgery, come, have it done, go home the same day. We're in a sling usually for the first 4 weeks. Physical therapy starts the week after surgery. Raising the arm up overhead on your own is about 6 to 8 weeks. Lifting restrictions for 6 months. So 6 months before we'd let you do unrestricted, whatever heavy lifting you want to do. And it takes about that long for the rotator cuff to heal. I'll tell patients that about 6 months after rotator cuff, they ought to feel like their shoulder's about 80% back to normal. It takes the second 6 months or the 1 year anniversary from the surgery to get the final 20%. And unfortunately, there's not much you can do to help speed that up type deal. Some quick things to be successful for rotator cuff surgery is, number one, your surgeon will describe how to take the medicines starting the day after surgery. Right after rotator cuff is not a day for you to kind of alter the recipe. Follow the cookbook. We mainly want you to start the medicine while the arm is still numb and the block is in effect. When the nerve block wears off the next day, there can be a little bit of rebound pain, and we want you to have that medicine already on board. The other thing is kind of timing the rotator cuff. Most of the time, we have some months to play around with of when a patient decides they want to have rotator cuff surgery, where it doesn't really, there's not a negative to the patient's shoulder condition by waiting. And there's never a great time in your life to go through rotator cuff recovery, but there are obviously better times than not. An example, this time we're starting into March almost. So if I see a golfer with a rotator cuff problem, but he's still able to golf and still able to enjoy life, but it's bothering him, most of the time we talk about, hey, let's do a cortisone shot so you can sleep better. Let's do a little bit of physical therapy so the shoulder gets better. let's let you enjoy golf this spring and summer. And then when the weather changes at the end of the season in November, let's do your rotator cuff surgery then, and you can rehab during the winter. Other times people say, listen, we got a big wedding anniversary with a trip at the end of the year that's going to be very active. Patient will say, I want to be 100%, in November. Then that might push us to discussing surgery sooner than others. The biggest thing, though, is listening to the restrictions type deal and not pushing it too much. There's no way to work harder and get better quicker in this area. So the restrictions are key. I always ask patients when they decide on surgery, talk to friends that have had rotator cuff surgery, and that friends will tell you it takes a year to get maximum improvement. But I also tell them, listen, if you know a friend that hasn't had a good result from rotator cuff, ask them why not. And 9 out of 10 times, if they didn't have a good result from rotator cuff surgery, it's because they did not listen to the restrictions and they used the shoulder too soon, too quick type deal. And what happens is during surgery, we're trying to get the rotator cuff to heal down to your arm bone. And if you start using the muscle or firing the muscle by moving the arm and lifting heavy things too soon, too quick, you'll start to pull the muscle that we sewed down away from the bone, and the sutures that we're using to sew up will actually pull through the muscles. And then physical therapy is the key, and it's the right amount of physical therapy. Again, it's not work harder, get better, quicker type deal, but it's not doing anything. So it's working with the therapist, that fine line, and just doing what the right amount is to do for that type deal. So we have a couple of pictures that we can show of an axial arthroscopic rotator cuff. So this is kind of that same view. We're looking down on the shoulder. The white is the muscle. Now it's covering the yellow top of the arm bone. And the sutures we use to sew them down in this picture are blue, and they actually look like a braided friendship bracelet that a middle school girl would wear. And they're not dissolvable, but their job is to press the arm down, press the muscle down to the arm bone for it to heal. And then I'll show you another picture of what the patch looks like. So again, the patch is like retreading the tire if it's needed. It takes about 7 minutes on the back end of the surgery. It's still done through poke holes. And again, over the next 6 months, that patch will incorporate into your rotator cuff, and the purple staples go away. And again, it gives us a thicker rotator cuff with some newer type tissue to hopefully give us a better result. So we're open to any questions that we can help answer about rotator cuffs or shoulder problems in general. So first question is, how often does rotator cuff tears and shoulder impingement occur at the same time? Excellent question. So shoulder impingement is the early spectrum of rotator cuff pathology type deal. So impingement means when you raise your arm, the top of the arm bone pinches the top of the shoulder blade. And the bursa, when we get bursitis, sits in between there. And the bursa is a gel sac of fluid that's to protect the rotator cuff from the muscle or from the bones pinching it. So once we start pinching the bursa and we start getting bursitis, if that continues to occur and stays inflamed, the process can then lead to you starting to tear the rotator cuff. So on the spectrum of rotator cuff, where you have a full thickness rotator cuff, impingement is the early stages. And that's a lot for degenerative rotator cuff tears. When patients don't have an injury, they'll come back and say, listen, I had a cortisone injection 5 years ago for bursitis. Can a tear heal itself? Excellent question. So a full thickness rotator cuff tear, so where the rotator cuff is pulled away from the arm bone, those will not heal on their own. But then the better question is, well, can people get better without surgery, even if the rotator cuff doesn't heal? And a lot of times people can. But again, people get better not by the rotator cuff healing on its own, but what happens is the shoulder starts to kind of relearn how we need it to work and compensate. So these other 3 rotator cuff muscles can start picking up the slack for the muscles that's torn. And that's where the physical therapy, when we're trying to get better without surgery, physical therapy in this is not to get strength and work harder. It's more about muscle re-education, trying to teach the remaining rotator cuffs how we need it to work different to power the arm to compensate for the rotator cuff that's healed type deal. How long do shoulder implants last? Had rotator cuff and labral repair a few years ago. So rotator cuffs, to get them to heal, once you sew them down with surgery, usually take about 4 months. So there's no dissolvable stitches that last that long. So the sutures that we use, again, are braided, and they're permanent. Your shoulder will rescar over them type deal, and the bursal reforms over it type deal. So the sutures that are in there last. A lot of the little drywall anchors that we use to anchor the bone resorb back to bone over the course of a year or two. I always tell people when it comes to rotator cuff, though, I'm repairing the rotator cuff of yours that has torn. So I'm doing a restoration surgery. I can't give you a new rotator cuff. So another question that stems from the question is, well, how good do rotator cuffs heal? And again, that's the whole key of getting what was torn to heal and then changing the mechanics of the shoulder to lower the chances of re-tearing in the future. Next question leads to it. My repairs have retorn. Is there anything to do other than replacement those shoulders? So part of this is genetic. So when people come to rotator cuff problems, some parents give us 80,000 mile rotator cuffs. Other of our parents give us 50,000 mile rotator cuffs. So 50% is just the genetics and the type of rotator cuffs you were built with in terms of quality. The other 50% of the problem is how hard the driver or the patient have been using these rotator cuffs, over the years, whether that's playing sport or physically demanding jobs type deal. So rotator cuffs can be repaired a second time. When a repaired rotator cuff is retorn, this is usually a case where we will get an MRI just to get an idea of the muscle quality and the structure of the shoulder. You can go in there and re-repair them with the camera arthroscopically. If we can get it sewn back down, we can add a patch on that to kind of bring some new tissue to hopefully get it to heal and lower the chances of re-tearing. But a lot depends on the quality of the rotator cuff and how far it's pulled away from the bone. The other end of the spectrum that the question asks, there is a reverse shoulder replacement. There are options in between, depending on the structure of the shoulder, the function the patient has now. Sometimes we'll go in and just clean up the shoulder, make sure the torn rotator cuff, if it's not repairable, is not getting caught between the ball and socket joint. We can take care of the bicep tendon. That can be a source of pain. They do make different type of patches you can use to kind of replace a rotator cuff or put it in the space where the rotator cuff is. They make different type of gel implants, like an inflatable balloon that you can place in there. So there are some very small niches in between re-repairing a rotator cuff if it's repairable and shoulder replacement deal. So the question is, I have autoimmune mixed connective tissue disease. Will I flare up from the foreign bodies within the joint, a patch, and staples? Good question. The patch and staples can cause an inflammatory process, but that's in patients with or without autoimmune mixed connective disease disorder. My experience has been with the patch in patients with autoimmune disorders, that the autoimmune disorder does not increase the very short inflammation the patch and the staples cause. In fact, obviously having an autoimmune disorder increases the risk of the rotator cuff not healing, which really encourages me to use the patch more in patients with autoimmune disorders type deal. If it's not, the question is, if it's not a tear and just inflamed, how long before experiencing no pain? So again, excellent question. A lot depends on how aggressive the patient wants to be in treating it. So even if somebody has a rotator cuff tear or not, if their plan, or the patient's plan is to go non-operative, we'll kind of ask them, how soon do they want to get to feeling good? And a quick way to start feeling better in terms of pain relief is a cortisone injection. That can be done at the office setting. Within a couple of days, it can really decrease the pain. We'll also do oral anti-inflammatories that can take a few days to work. And those are kind of the short-term solutions. Hey, let's make next week and 2 weeks and 3 weeks better so we can rest and get back to normal. But going into the physical therapy and re-educating the muscles, that's more of the long-term solution. So, if it's not torn and just inflamed, more like in a bursitis, usually a cortisone injection can knock that out within a few days. Can you regain full mobility after frozen shoulder surgery? So usually we see frozen shoulder a lot for no rhyme or reason. It's usually in ladies age 40 to 60. Usually there's been no injury or trauma. It's more common also in patients with blood sugar problems, so diabetes, even if it's well controlled, and also with thyroid disorder. And again, usually the initial treatment for a frozen shoulder, which is just stiffness of the joint, loss of motion, the rotator cuff is good, will be consideration of a cortisone injection, anti-inflammatories, and some very diligent home stretching multiple times throughout the day. When it comes to a frozen shoulder, if you think of the ball and socket and put that in a glass snow globe, the glass of the snow globe is the capsule or lining of the shoulder. And that glass snow globe should be plastic, like a plastic grocery bag, really thin. Well, in a frozen shoulder, that plastic capsule is thickened, so it's more like a paper grocery sack. So now the ball and socket can't move. And at surgery, we just cut that capsule or the glass of the snow globe 360 degrees and we get the motion back. And I always tell people, I can clean out the scar tissue and get the motion, but I can't change how your parents built the shoulder. I can't change if we're a middle-aged female. I can't take away diabetes or thyroid problems. So your shoulder, even after we release it and get the motion back, is going to want to scar back up. And that's where it's really important to be diligent with the pain management that we spell out. Normally, we'll start physical therapy the day of the surgery and go so many days in a row, and then 3 times a week for the remainder 4 weeks. And if we can make it 6 weeks out by keeping the motion, then we're good. But normally, we regain full mobility after frozen shoulder surgery. We do see stiffness after rotator cuff surgery. Females can be a little bit more, especially middle-aged females can be a little bit more prone to it type deal. And that's where we really want people to start, especially the first 6 weeks. It's a lot of stretching just to get the motion back to kind of prevent the shoulder from freezing up. And the biggest reason is until you work the stiffness out after rotator cuff surgery, the shoulder is not going to feel normal. I mean, it's going to be uncomfortable to sleep. You're always, going to notice the weather changes, whether it's rain or the cold weather. I always tell people when the shoulder's stiff, the shoulder acts like a little sister. It's always there and aggravating. So getting the stiffness out after rotator cuff surgery allows your shoulder to get back to feeling normal, even though we don't release you to full activities yet. But at least you're not always constantly having your shoulder, having the pain and achiness in the back of your mind. Do you recommend any supplements for tendon and joint health? There are some that patients of mine use. A very typical one that a lot of us already take into multivitamins, vitamin C. So vitamin C is a supplement for tendon and joint health. The other one that's common would be a collagen supplement or a hyaluronic acid with glucosamine and chondroitin. Those especially in the lab and research, have been shown to help tendon quality and healing. I always tell patients they have my blessing if it's something they want to try to see if that can provide benefit. It is something, if you're going to take, you usually have to take it for 2 weeks. Take it for 2 months before you know if it's going to help or not. The other thing is when it comes to supplements, those are not controlled by the Food and Drug Administration here in the U.S., so there's no standardization. So usually if people are going to get supplements, I'll usually have them look on the bottle for USP, and it just means that supplement company has been independent tested to know what it says on the bottle is actually present. What is the effectiveness of braces for rotator cuff injuries? So in general, when somebody has a rotator cuff injury, a lot of times they want to put the arm in just a regular sling. And that can be okay for a couple of days after an injury or if it's really flared up. But we really encourage you to get out of a sling as quick as we can. I always tell you, a shoulder is kind of like a car engine. It's meant to be driven and used. It doesn't do well if you parked in the garage and don't use it. It leads to stiffness type deal. So even with a rotator cuff injury, once the muscle has had damage to it, you can't necessarily make the damage worse. Now you might make it hurt worse, but doing what you can do and trying to use it as best you can as a normal shoulder is usually a good thing. They do make some over-the-counter braces for rotator cuff, and it's usually a compression sleeve that goes mid-arm up the shoulder, and then it has a crossbody strap that you can use, and patients will use that sometime for sleeping or during the day if they're having some rotator cuff tendonitis and they have a very intense workout activity or competition they're doing. It can be a little cumbersome sometimes if your shoulder's really inflamed. It's kind of you and somebody else helping kind of job, but they do make over-the-counter rotator cuff compression braces that can provide some benefits for patients, especially in terms of pain relief. Do you have any techniques and recommendations for managing shoulder pain? Yeah, the number one is, again, the sleeping tricks that we talked about. Sleeping, sitting up, having a little extra sofa pillow behind your shoulder blade to roll it forward, taking anti-inflammatories if your family doctor or primary care team will allow you. And then also for sleeping, taking something like a Tylenol PM, an over-the-counter Unisom sleep aid. Again, once we're sleeping at night, then we can kind of focus on the shoulder. But if we're not getting consistent sleep, it's hard to, follow through with any type of plan to manage the actual problem of the shoulder. Again, during the day, heat tends to work better on shoulder pain. Ice at night. So if sun's up, think heat if the shoulder's hurting. At night, think ice. And then physical therapy can be very beneficial in decreasing shoulder problems. A lot of times even going online to like Ortho Info, rotator cuff problems, that's the Orthopedic North American Academy's website that has exercises that you can do at home for pretty much any orthopedic problem, but specifically rotator cuffs, that you can start that from home for any shoulder condition that can provide benefit and reduction in pain. Can you explain the importance of daily stretching in long-term physical rehab? Man, that's when it comes to shoulders, stretching is important type deal. And it's like anything else that we're doing active, right? We'd rather focus on the lifting and the strengthening more than the stretches because it's more fun type deal. But stretches are important. I always try to tell people, it's hard to carve out 10 minutes a day to stretch. But try to stretch whenever we have 10 or 15 minutes or 10 or 15 seconds here or there. Like if we're waiting for the coffee to brew, stretch. Waiting for something in the microwave, good time to stretch. Even at a red light, putting your arm around the passenger seat and stretching is a good one type deal. So try to take 10 seconds here or there to stretch the shoulder is really important in terms of rehab of the shoulder. Again, we need to get the motion back to the shoulder before we can effectively start strengthening the muscle and the strength in the shoulder. My right shoulder has severe arthritis and my left has a rotator cuff injury. What is the best advice for me? PT has not helped much. What can you say about shoulder replacement? So very different surgeries. Rotator cuff repair, we're taking your tissue, sewing it back down for your shoulder to heal. Whereas in shoulder replacement, we're replacing the parts. We're giving you metal, plastic, and metal, very similar to a hip or knee replacement. Majority of these surgeries now, even shoulder replacements, are being done at an outpatient surgery center. So come have the surgery, go home the same day. Rotator cuff surgery, again, is done through poke holes type deal. So in the realm of it, you think it's a minor surgery because it's done through poke holes. But rotator cuff surgery has a very long recovery because, again, we're sewing down your tissue to get it to heal. Well, in a shoulder replacement standpoint, we're replacing all of it. So we don't really have that much to heal. We just got to let things calm down and then let the shoulder start to learn how we wanted to learn with a replacement. So a shoulder replacement is, in theory, a quicker recovery. It's a less painful recovery, and it's a quicker recovery than a rotator cuff repair. Shot and rehab. Why would it not happen again? I read acromial tears or rub, so it's to be a problem again. Yeah, that's true. People are sometimes shocked when I tell them they have a rotator cuff tear, and 70% of them can get better without surgery, even though the rotator cuff doesn't heal. And if we go back to that X-ray we showed earlier, this is a spectrum. This process has been going on for a while, and people say, "Well, I've been hurting for 2 months. You tell me I have a rotator cuff tear," and I'm like, "Man, look at the X-ray. You've had a rotator cuff tear for 2 years, right? And 6 months ago you said your shoulder was fine." So again, it's a spectrum, and as these rotator cuff fibers start to fray, they'll start to unravel at times. When that happens, it can kind of throw your shoulder out of alignment or off balance. And a lot of times, if you're patient, continue to use the shoulder, do some physical therapy, give it a chance to rest, your shoulder, just by using it in time, will reestablish that balance and go back to being pain-free. What surprises most people is most people age 60 and older, more people have a rotator cuff tear. And those are the ones that don't have any pain, have never had any injury, have never needed any shots. And the tears are small and their shoulder's able to compensate for it, that they don't even know they have a rotator cuff tear. So next dinner party, your friends that are over the age of 60, over 50% of them have a rotator cuff tear, and they don't even know it because it doesn't give them problems. I have a partial tear in my rotator cuff and the bicep tendon in the shoulder, along with the bone spurs. Can physical therapy resolve these issues, or is surgery the only way to correct all three? No, I would imagine physical therapy has a better than not chance of improving the symptoms to a point so a patient would be happy with it. And that's where, again, if we're having acute pain, trouble sleeping, that's where an injection can help. And then the physical therapy can help resolve some of the conditions type deal. And again, people always say, well, I have a bone spur. Well, the bone spur is just the shape of this shoulder blade bone. And the model, it's flat, but in most of us, it hooks down so it can dig into the rotator cuff. And I always tell people that's a lot of that's how your mom and dad built you. So that's been kind of rubbing on the bursa and the rotator cuff for a long period of time. And it's just now started to cause symptoms. And again, when we say physical therapy and injection, this is not to do forever. Do it for 8 weeks. And usually more often than not, it'll get to a point where it's non-symptomatic for the patient. If at 8 weeks it's still giving you trouble, then that's something you can sit down with your surgeon and discuss surgical options that can resolve the pain and the symptoms in the shoulder. Yeah, is it possible to have a rotator cuff 15 to 20 years earlier due to an injury and then not really have much pain after the acute injury and then just have the pain pop up again later in life from the initial injury? Yeah, very common. And again, this goes back to that degenerative type tear. the rotator cuff had an injury. It was fairly stable. The shoulder was able to relearn how we want it to work with that tear in the rotator cuff. And then what happens again is now the pain just comes up again without another injury. And it just means that rotator cuff tear has gotten a little bit bigger and your shoulder's now kind of out of balance. And that's leading to the symptoms of pain and weakness. And those are ones where conservative treatment measures for 8 weeks, up to 70% of those can get better with non-surgical management. Do you see patches being used in certain patient populations more than others? Older versus younger, athletes versus non-athletes. So in my practice, I would say I use patches more often than not, mainly to improve the healing rate of the rotator cuff tear and lower the re-tear rate. I do think in degenerative tears, so older patient population where the tendon quality and the muscle quality is not going to be as good, bringing new tissue in from the collagen patch can be beneficial. I also use it a lot in patients that are middle-aged, that are manual laborers, patients that have strenuous jobs, repetitive heavy lifting. I think using the patch to bring new tissue to give them a thicker rotator cuff can lower the re-tear rate of them re-tearing it over the next 20 years and give them a little bit more strength in the shoulder to do their heavy nature job. Is stretching good if torn? Yes. Yeah, because our natural thing is, if we have an acute injury to the shoulder or the shoulder's flared up, it hurts. Our natural instinct is not to use it. Well, the shoulder is one of those, if you don't use it, you lose it type joint, and it's going to start to seize up. And if the shoulder starts to get stiff, it's going to increase the pain. And if it starts to actually freeze up and we get a frozen shoulder, now we just traded one rotator cuff problem for an even bigger problem of a frozen shoulder. So again, stretching to me, when it comes to your shoulder hurting, it's always easier to keep the arm still and move your body to stretch than keep your body still and move the shoulder. So case in point, instead of me sliding a hand up the wall where I'm keeping my body still and moving the shoulder, it's a lot easier to keep your hand on a countertop and walk back and lean forward. And that's the same way of raising the arm, but keeping your hand and arm still and moving your body is an easy way to stretch the shoulder. But yeah, stretching is good, and getting range of motion back is important because it mainly helps with pain relief. Do you recommend MRI or ultrasound to see if it's a tear? In my practice, again, I'm lucky that we have a provider here, Scott, that's very facile with the ultrasound machine. I do the ultrasound machine. 95% of the time, we can get the information we need from the ultrasound. Again, it's cheaper to the patient. It's a lot more convenient. We're not getting delayed by insurance approvals. We can go in and get the ultrasound, and it's just more comfortable to sit in the exam room, in a tank top with an ultrasound probe, than it is laying in an MRI tube for 20 minutes and somebody telling you to be still. The other thing too is obviously those of us that have had an MRI, you lay still there, so it's a kind of a still image of your shoulder. Well, when we have the ultrasound probe on your shoulder, we can actually move your arm while the probe's on there, so we can get visualization of how your shoulder is moving. Let's get it up. You said it hurts in this position. Well, let's put the ultrasound in that when your arm's in that position, and let's see the shoulder blade and the ball pinching the rotator cuff where the area is torn. So at least in my practice, we have the convenience or the ability to get an ultrasound, and I think it's a better experience for the patient. I am scheduled for rotator cuff surgery tomorrow. What is the debridement and how will it impact my range of motion after PT? So again, normally in a shoulder, the shoulder is going to have wear in it throughout, not just the rotator cuff type deal. So usually the debridement is cleaning up the labrum, which is the structure around the socket, If we have some flaking to the cartilage, the surgeon will go in there and debride that flaking cartilage to make things smooth again. If there's damage to the bicep tendon, they can debride that. Obviously, a lot of the rotator cuff tearing causes inflammation to the shoulder, and the surgeon can debride that at the time of surgery to get the inflammation out. So usually the debridement will help speed up the recovery in terms of allowing you to get motion back a little bit quicker with physical therapy. I have complex regional pain syndrome from rotator cuff surgery. I am having pain again. I think it's impingement. What should I do? The biggest thing is I would try to start out with making sure the motion, obviously with complex regional pain syndrome, motion to the joint is going to be good, gentle stretching type deal. I would get back with usually a pain management type doctor can help manage the regional pain syndrome, but also some of the medications that can help. But I would probably consider for that a cortisone injection, because impingement is going to lead to bursitis, and that's going to be our problem within the shoulder. And a cortisone injection into the bursa, where impingement is, will at least take care of that. Might be temporary, but doing an injection in the shoulder can help with the bursitis and impingement. If the pain's coming from a symptom of the complex regional pain syndrome, then a cortisone injection in the shoulder is not going to be able to help the regional pain syndrome. So it's a way to kind of decipher what's coming from the shoulder versus what's coming from the CRPS type deal. I think I would also have a low indication based off the results of the cortisone of getting some sort of imaging to take a look at the shoulder if there's concerns that the source of pain could be coming from the shoulder joint. I had a torn labrum 5 years ago, has been hurting since, was told it would heal on its own without surgery. I'm 69. What do you recommend? Again, usually as we get older, when we start thinking about torn labrums, what we're thinking of is what we call a slap lesion. And if you think of your bicep tendon runs in this groove in the front of your shoulder and attaches right on the socket at the 12 o'clock position. And a torn labrum at the 12 o'clock position means the bicep attachment is loose, which means the bicep tendon's off tension. And that little extra play allows the bicep to windshield wiper in and out of this groove type deal. I would normally say if the symptoms have been going on for 5 years and hasn't gotten better, I would discuss some possible new imaging to the shoulder or a new evaluation. There can be some very targeted injections that can be performed to help provide pain relief. Sometimes under ultrasound, injections under ultrasound can help. But getting it reevaluated with an imaging, and at some point, if it's still giving you trouble, consider surgical intervention to take care of the problem. The pain caused by a torn labrum can be addressed really successfully with surgery. So thank you all for attending the OC Live webinar series. A replay of this will be posted to Facebook and YouTube. I appreciate everybody. Good night, and remember, OrthoCarolina, each location has a shoulder and sports medicine surgeon that will be happy to take care of your problems.